What imaging tests are used to diagnose bone tumors? When it comes to diagnosing bone tumors, several imaging tests play a crucial role. These tests help visualize the bone structure, detect any abnormalities, and assess the tumor's nature and extent. Let's explore the common imaging tests used in this process. First up is the X-ray. This is usually the first test performed when a bone tumor is suspected. X-rays provide detailed images of the bone structure and can reveal abnormal growths, lesions, or fractures. They are essential in distinguishing between benign and malignant tumors based on their appearance and location. Next, we have the computed tomography scan, commonly known as a CORT scan. This test produces cross-sectional images of the bone and surrounding tissues. CORT scans offer more detailed information than X-rays, especially for complex bone structures. They help determine the size, shape, and exact location of a tumor and assess whether it has spread to nearby tissues. Another important imaging test is magnetic resonance imaging, or MRI. This technique uses magnetic fields and radio waves to create detailed images of bones, bone marrow, and soft tissues. MRI is particularly useful for evaluating the extent of the tumor within the bone and its involvement with surrounding muscles, nerves, and blood vessels. It is often used to plan surgery or other treatments. A bone scan, which is a type of nuclear medicine imaging, is also utilized. This test involves injecting a small amount of radioactive material that accumulates in areas of high bone activity. Bone scans help detect bone tumors, metastases, and other abnormalities. They are sensitive for identifying multiple bone lesions that may not be visible on X-rays. The positron emission tomography scan, or PET scan, is another valuable tool. PET scans detect the metabolic activity of cells using radioactive tracers. Since cancer cells often have higher metabolic rates, PET scans can help identify malignant bone tumors and metastases. Sometimes, PET scans are combined with CORT scans for more precise localization. Lastly, we have ultrasound. While less commonly used for bone tumors, ultrasound can evaluate soft tissue masses adjacent to bones and may assist in guiding needle biopsies for tissue sampling. These imaging tests are often used together to provide a comprehensive assessment. For instance, an initial X-ray may be followed by MRI or CORT scans for a more detailed evaluation. After imaging, a biopsy is usually performed to confirm the diagnosis by examining tumor cells under a microscope. It's essential that all imaging and diagnosis are conducted under the guidance of healthcare professionals specializing in bone cancers. This ensures accurate interpretation and appropriate treatment planning. Imaging tests are just one part of a broader diagnostic process that includes clinical examinations, laboratory tests, and histological analysis. In summary, the main imaging tests used to diagnose bone tumors include X-rays, CORT scans, MRI, bone scans, PET scans, and occasionally ultrasound. Each of these tests provides unique information that contributes to a precise diagnosis and effective management of bone cancer. Always consult with healthcare professionals for personalized medical advice.